Welcome to today's video about early signs of heart failure that could save your life. What if I told you that your body is sending you warning signals right now? Signals that could save your life, but you're probably ignoring them. Every year, over 6 million Americans live with heart failure. Yet, most don't recognize the early warning signs until it's almost too late. Here's the shocking truth. Medical research shows that most people dismiss these early symptoms as normal aging, stress, or being out of shape. But what they don't realize is that their heart is desperately trying to tell them something critical. Today, we're going to uncover 13 early signs of heart failure that most people completely overlook. Some of these might surprise you, like a simple symptom that happens when you bend over to tie your shoes, or why you're suddenly waking up at night needing more pillows. By the end of this video, you'll know exactly what to watch for and when to seek medical attention. Before we dive into these life-saving symptoms, if you're new here, welcome to Ageless Her, our community dedicated to empowering women's health at every stage of life. Make sure to hit that subscribe button and ring the notification bell so you never miss content that could literally save your life. Drop a comment below telling us where you're watching from. We love connecting with viewers from around the world who are taking charge of their health. Let's dive into these life-saving warning signs. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified and references are available. Now, let's begin with sign number 1 that might signal heart trouble. Sign 1, shortness of breath on activity. The first warning sign that most people brush off as getting older is shortness of breath during activities that used to be easy. This isn't about being winded after intense exercise. We're talking about feeling breathless climbing a single flight of stairs or walking to your mailbox. According to research from the American Heart Association, this type of exertional dyspnea is one of the earliest and most common symptoms of heart failure. What's happening inside your body is that your heart isn't pumping efficiently enough to meet your muscles' oxygen demands during physical activity. When your heart can't keep up, your breathing becomes labored as your lungs work overtime to compensate. The key difference between normal fatigue and heart failure symptoms is the progression. If you notice that activities that were once effortless now leave you breathless, or if you need to stop and rest during routine tasks, this is your heart's cry for help. Medical studies show that this symptom often appears months before other obvious signs of heart failure. Don't dismiss this as simply being out of shape. Sign 2, orthopnea, needing more pillows to sleep. Here's a symptom that often creeps up so gradually that people don't realize it's abnormal. Needing more and more pillows to breathe comfortably while sleeping. This condition, called orthopnea, is a telltale sign that your heart is struggling to pump effectively. When you lie flat, gravity stops helping your heart pump blood back from your legs and lower body. If your heart is weakened, blood can back up in the pulmonary veins, the vessels that return blood from your lungs to your hearts. This backup causes fluid to leak into your lungs, making it harder to breathe when lying down. Research from leading cardiology centers shows that orthopnea is present in approximately 80% of patients with heart failure. What makes this symptom particularly insidious is how it develops slowly. You might start with 1 extra pillow, then 2, then find yourself sleeping in a recliner because it's the only way you can breathe comfortably. Many people rationalize this change, thinking it's just a preference or comfort issue. But if you've gone from sleeping flat to needing multiple pillows, or even sleeping upright to breathe properly, your heart is telling you something important. Sign 3, paroxysmal nocturnal dyspnea, waking up, gasping. Imagine waking up suddenly, gasping for air, feeling like you're drowning. Your heart is racing, you're panicked, and you need to sit up or even stand to catch your breath. This terrifying experience is called paroxysmal nocturnal dyspnea, and it's a serious warning sign of heart failure. This symptom occurs because when you're lying down for extended periods, fluid that accumulated in your legs during the day redistributes throughout your body, including to your lungs. Your already compromised heart can't handle this sudden increase in fluid volume, causing acute shortness of breath that jolts you awake. Clinical studies indicate that this symptom typically occurs 2 to 4 hours after falling asleep and can be one of the most frightening experiences for heart failure patients. The episodes often force people to rush to an open window or door, desperately seeking fresh air. What makes this symptom particularly dangerous is that people often attribute these episodes to nightmares, anxiety, or sleep apnea. While these conditions can cause sleep disturbances, the specific pattern of waking up gasping for air, especially if it's becoming more frequent, warrants immediate medical evaluation. Sign 4. Overwhelming fatigue and reduced exercise tolerance. The fourth warning sign is perhaps the most commonly dismissed, an overwhelming fatigue that makes daily tasks feel exhausting. This isn't ordinary tiredness that improves with rest. It's a persistent exhaustion that continues despite adequate sleep and makes activities you once enjoyed feel impossible. When your heart fails to pump efficiently, your body diverts blood flow away from the less critical organs and sends it to vital areas like your heart and brain. This means your muscles receive less oxygen-rich blood, leading to profound fatigue and weakness. Studies show that this symptom can appear months before other obvious signs of heart failure. What's particularly concerning is how this fatigue affects exercise tolerance. You might notice that your recovery time after physical activity becomes dramatically longer. A short walk that once left you feeling energized now requires a lengthy rest period. The progression is often so gradual that people adapt their lifestyle without realizing it. They start avoiding activities, making excuses, or blaming age. But this progressive decline in stamina isn't normal aging. It's your heart struggling to meet your body's basic needs. Sign 5, ankle or leg swelling. One of the most visible early signs of heart failure is swelling in your ankles, feet, or legs, medically known as peripheral edema. This isn't the temporary puffiness you might get from sitting too long. This is persistent swelling that gets progressively worse, especially by the end of the day. When your heart can't pump effectively, blood doesn't circulate properly and begins to pool in your lower extremities. Additionally, your kidneys receiving less blood flow start retaining sodium and water. This combination forces fluid from your blood vessels into surrounding tissues, causing swelling. Research published in major cardiology journals shows that peripheral edema is present in approximately 70% of heart failure patients at diagnosis. The swelling typically starts in the feet and ankles and can progress up to the calves and thighs. You might notice that your socks leave deep indentations, your shoes feel tight by evening, or rings that once fit comfortably now feel too snug. The pattern is important. Heart failure-related swelling is usually symmetrical, affecting both legs equally and worsens throughout the day due to gravity. Sign 6. Rapid weight gain from fluid retention. Perhaps the most measurable early warning sign of heart failure is rapid weight gain due to fluid retention. We're not talking about gradual weight gain from overeating. This is a sudden increase that can happen over just a few days and should set off immediate alarm bells. Medical guidelines from the American Heart Association specify that gaining 2 to 3 pounds in a single day or 5 pounds or more in a week warrants an urgent call to your healthcare provider. This rapid weight gain occurs because your failing heart triggers hormonal responses that cause your kidneys to retain salt and water. Each kilogram of weight gain represents approximately 1 liter of excess fluid in your body. Studies emphasize that this weight gain happens before other symptoms become obvious. You might not yet notice swelling or shortness of breath, but the scale doesn't lie. Sign 7, nocturia, frequent nighttime urination. A symptom that often puzzles people is suddenly needing to urinate more frequently at night than during the day, a condition called nocturia. While many attribute this to age or drinking fluids before bed, it can actually be an early sign of heart failure that's often overlooked. During the day, when you're upright and active, gravity causes fluid to accumulate in your lower extremities. Your struggling heart can't effectively pump this fluid back to your kidneys for processing. However, when you lie down at night, gravity helps redistribute this pooled fluid back into your circulation. Your kidneys, suddenly receiving this flood of fluid, work overtime to process it, resulting in increased urine production. Research published in cardiology journals shows that nocturia can be one of the earliest signs of heart failure, sometimes appearing before more obvious symptoms like shortness of breath or swelling. Sign 8, night cough or wheeze. When lying down. A persistent cough that seems to appear only at night or when lying down is another subtle but significant warning sign of heart failure. This isn't the productive cough of a cold or the dry cough of allergies. It's often described as a nagging dry cough that disrupts sleep and improves when sitting upright. This nocturnal cough occurs due to the same mechanism that causes orthopnea. When you lie flat, fluid that has accumulated in your body during the day redistributes, potentially causing mild fluid buildup in your lungs. Your body's natural response is to cough in an attempt to clear what it perceives as an obstruction in your airways. Medical literature describes this cough as often being worse in the early hours of the morning and sometimes accompanied by a slight wheeze. Patients frequently report that the cough produces little to no sputum or occasionally brings up white or pink-tinged frothy mucus, a sign that fluid is indeed present in the lungs. Sign 9. Palpitations or irregular pulse. Your heart's rhythm can provide crucial early warnings about heart failure. Palpitations, the sensation of your heart fluttering, pounding, or skipping beats, often accompany the early stages of heart failure, as your heart works harder to pump blood effectively. When your heart muscle weakens, it may develop irregular rhythms as it struggles to maintain adequate circulation. You might feel like your heart is racing even when you're at rest, or experience the unsettling sensation of your heart skipping beats. Research from major cardiology centers shows that cardiac arrhythmias, particularly atrial fibrillation, are both a cause and consequence of heart failure. The relationship is bidirectional. Irregular heart rhythms can lead to heart failure, and heart failure can trigger dangerous arrhythmias. Sign 10. Dizziness or near fainting episodes. Dizziness, lightheadedness, or near fainting episodes can be frightening early indicators of heart failure. These symptoms occur because your weakened heart can't pump enough blood to maintain adequate circulation to your brain, especially during position changes or exertion. When you stand up quickly or exert yourself, your body normally compensates by increasing heart rate and adjusting blood vessel tone to maintain blood pressure. However, a failing heart can't make these adjustments effectively, leading to temporary drops in blood flow to the brain. Clinical studies indicate that syncope occurs in approximately 20% of heart failure patients and can be an early warning sign, sometimes appearing before other obvious symptoms. Sign 11. Abdominal bloating and poor appetite. Digestive symptoms might seem unrelated to heart health, but persistent abdominal bloating, loss of appetite, or feeling full after eating only small amounts can be early signs of heart failure. These symptoms occur because heart failure doesn't just affect your heart, it impacts your entire circulatory system, including blood flow to your digestive organs. When your heart can't pump effectively, blood flow to your gastrointestinal tract decreases. Additionally, fluid can accumulate in your abdomen, and your liver can become congested with blood that isn't being pumped efficiently. Sign 12. Bendopnea, shortness of breath. When bending forward. Here's a symptom so specific that most people have never heard of it, yet it's one of the most telling early signs of heart failure. Bendopnea is shortness of breath that occurs within 30 seconds of bending forward, such as when tying your shoes, picking something up from the floor, or leaning over a sink. Bendopnea was first characterized in medical literature in 2014, and research has shown it's a remarkably specific indicator of elevated heart pressures. When you bend forward, the position increases pressure in your abdomen, which pushes against your diaphragm and temporarily increases the pressure in your chest cavity. Studies published in major cardiology journals found that bendopnea is present in approximately 30% of heart failure patients and is strongly associated with more advanced disease and increased mortality risk. Sign 13. Cold hands or feet. The final warning sign involves changes in your circulation that you might notice in your extremities. Cold hands and feet, even in warm weather, can indicate that your heart isn't pumping with enough force to maintain proper circulation. When heart failure develops, your body prioritizes blood flow to vital organs like your brain and heart, reducing circulation to your hands and feet. This leads to persistently cold extremities, sometimes accompanied by a bluish tinge to the fingernails or lips. If you've recognized yourself in any of these 13 warning signs, don't panic, but don't ignore them either. Heart failure, when caught early, is a manageable condition. The key is recognizing these subtle signals your body is sending and taking action before a medical emergency occurs. Early detection and treatment of heart failure can dramatically improve your quality of life and longevity. Modern medicine has incredible tools to help manage heart failure, from medications that can strengthen your heart to lifestyle changes that can slow or even reverse the progression of the disease. If this video was helpful in understanding these important warning signs, kindly type "helpful" in the comments. Please like this video if it provided valuable information. Share it with everyone you care about and subscribe to Ageless Her for more life-saving health content. Thank you for taking charge of your heart health. Remember, your heart is worth listening to.